Okay, last video for the spine. Here we're looking at the neuroforamina. So we have the ventral root, the dorsal root with your spinous process. Here's your vertebral body. Here's your intervertebral foramen with the two within them. So in your pedicle heading posteriorly. And here is an MRI T1. So you have your dorsal root ganglion with your spinal artery in the lower portion of your intervertebral foramen. Your dorsal root ganglion, so here's your psoas muscles on either side. This person has pretty big psoas muscles, bigger than the body, so they're in good shape. Here's your dorsal root ganglion, and here's your cauda equina there in the middle with your nerves just free floating in there. So you can see here, this is your subarachnoid space, and this is your dorsal root going to your dorsal root ganglion here. So this is your spinal nerve coming out your dorsal ramus and the ventral ramus. This is an MRI heavily weighted T2. Coming down, you have your thecal sac and your dorsal root coming out, and here's your psoas muscle. So you can see the dorsal roots coming down and branching off into dorsal and ventral. Looking at the cord in the cervical spine, you can see you have your ventral median fissure coming in with your central canal with your dorsal horn. And then we go into the thoracic and we have a ventral and a dorsal horn with the lateral horn. We go into the lumbar, we have the ventral horn and the dorsal horn, and in the sacrum, ventral and dorsal. So sacrum with root sleeves, so you can see here, here's your cauda equina with your root there. That's your root sleeve with your sacrum. Same thing, root sleeve and your cauda equina. And you can see your dorsal root coming out on this one. This is a CT myelogram. The contrast is in the subarachnoid space. So this is T6, and we're looking at the body here, and you have your thoracic spinal cord, the gray, and then here's your descending aorta. You have contrast in your subarachnoid space and your spinous process, and you have a rib coming off here. You have your ventral root and your dorsal root with your conus medullaris. You're at T12, so it should be ending right about in that area. Here we have your epidural fat. So you're going to see a fat pad posteriorly on these. We have your subarachnoid space with some contrast in it. This is a CT. You have your dorsal root and your ventral root. You can see here the lay of the land, so this gives you an idea. This is your cord, and you have your ventral root and your dorsal root that come to your nerve sleeve, which goes to your root. So you have your ventral ramus and your dorsal ramus. Now your nerve plexuses, you have your brachial plexus, you have your lumbar plexus, and your lumbar sacral plexus. So here is your cervical plexus, here's your cord, and your cervical plexus, you can see a bunch of nerves coming out off to the side. This is your sternoclenoid mastoid muscle. These are your brachial plexus also coming down, so all in through here, all those little gray stripes. This is your subclavian artery. This is an oblique. You can see here we're cutting through the foramina, so we can see the plexus. So this is an MRI, and it's a T2. You can see the nerves within the intervertebral foramen coming out. So we look to see if there's any impingement on those. This kind of gives you an idea what we're talking about when we say the brachial plexus. So we have the common carotid artery coming up with the subclavian vein, and here's your subclavian artery, and here is your low, middle, and upper trunk of your brachial plexus. So you have your posterior scalene, your middle scalene, and your anterior scalene, so you can see them coming out right between those two muscles. So your odontoid process with your sternoclenoid mastoid muscle coming down and around. Your left subclavian artery is there, and you can see all those little stripes coming out and around. That is your brachial plexus. Okay, so this is a good diagram to give you an idea of what's going on here. So right here in the middle, this big round tube is your trachea. Your thyroid gland wraps around it. Directly behind that and in front of the body is your esophagus. It's usually collapsed, so it just looks like a gray ball, like a muscle. So the esophagus is a muscle. Here's your sternoclenoid mastoid muscle. Here's your left internal jugular and your left common carotid artery. We're coming down and around. Here's your multifidus muscle, and then you have your semispinalis capitis muscle along with your scalenus capitis muscle and your trapezius along the back. Your spinal cord right there in the middle with your posterior scalene, middle scalene with your brachial plexus that runs in between the middle and the anterior scalene muscle. So your brachial plexus is between your anterior and your middle scalene muscle, so it comes right through the middle there. Here is an MRI. It's a PD, so it's kind of confusing. It says T1, but it's pretty heavily weighted. So here's your trachea. This is your esophagus. Remember how I said it's collapsed muscle? And here's your body. So this is your spinal cord here. Internal jugular is there. Your vertebral artery is there. Brachial plexus is coming out here, and here's your middle scalene muscle. Here's a sagittal view. So if we start with the clavicle, we have your clavicle, then we have your internal jugular vein, and here we have your subclavian artery and vein along with your brachial plexus. This is where we're looking right there. So this is your sternoclenoid mastoid muscle coming down from back by your mastoid air cells, wrapping around and attaching to your clavicle. So looking at this picture here, this is what a normal brachial plexus looks like. You can see all the motion from the patient breathing. They're usually not very pretty. Here's your trapezius muscle, your supraspinalis muscle. We're going to come around. Here's your brachial plexus with your subclavian artery and subclavian vein with your clavicle, and this is your pectoralis major muscle. When we go down to your lumbar and sacral plexuses, I just wanted you to get an idea how much nerves are coming out through your lower spine. So the biggest one is your sciatic nerve. When that gets impinged, you get a lot of very strange pains that wrap around to your medial thigh, a lot of hip pain. So here's your pectoralis major, that is not your pectoralis major. This is your psoas muscle. So we're down. Here's a kidney on both sides. So this is not your pectoralis major muscle because that's up in your chest. So this is your psoas muscles, and your lumbar plexus is coming out. You can see the gray stripes. That is your nerves. So looking at this, your dorsal root ganglion, and then you have your spinal artery on the lower portion there. And this is a great image of your sciatic nerve coming down. So really big bundle there. This is your sacrum. This is your root sleeve with your cauda equina. And you have within your spinal cord, you've got your spinal artery. So you can see that right down the middle. So here's your left kidney and your liver. This is your right lung, left lung. So anterior spinal artery, see that little ditzel right there? That's it. That's it. Looking here, you can see that you have an artery coming across. This is with contrast, so it's coming out from the aorta, heading back to feed the spine. And the venous system, as you can see, is very complex. There's a lot. And I want to show you the venous plexus. You can see right anterior to the cauda equina, but posterior to the body. So you can see here you have your posterior longitudinal ligament that runs posterior to your venous plexus. And remember that little ditzel in there that said looks like cancer? So that's your basivertebral vein. All right, so that does it for your spine. I'll have a lab all set up for you. Make sure you do your workbook and bring it to class.